So once Botox settles, it's not that you can reverse. The only thing is that you can do is just wait, because it is FDA approved for 3 months. So it's not that it's gonna be there forever. So if there is any specific look that you don't like or you wanna change, you'd rather wait. The best for that is that we always undertreat. So rather undertreat and add more units later once the Botox settle than overtreat and then you have to wait because there is no reverse. For example, there is some medications, like if you had too much Botox done and there is a heavy eyelid or heavy eyebrow that causes the eyelid to come down, there is a medication, eye drops, that it can help with lifting of the eyelid, and that is almost like just a treatment that you can do until the Botox goes away. So it's not a treatment that is gonna solve the problem, it's just that it's gonna help you go through until Botox goes away. Most of the time when people want to reverse Botox is because they either had too much or they just changed their face. The most important for that is just undertreat. You'd rather have more Botox later on than having too much at once. What we do is we develop a plan with the client and we talk about the results we're getting. And from there is that either the patient said, you know what, I like my eyebrows high or I like my eyebrows straight, and it's also based on their anatomy. From there, we can say, okay, we're gonna do this treatment because you have the high tendency of lifting your eyebrows. So I need to correct that first, and then we can go to the next step. So for example, in my face, I have high arch, but if I put too much Botox here, it's not gonna look that great. The idea is that I wanted to leave this area moving in order to maintain the same position of my eyebrows, and that is done with Botox. So I don't need to overdo it at the beginning. I just need to make sure that I know the anatomy of the face, and from there we can get that specific look. In order to maintain a natural look, that's what it's important to do the consultation, because they may say that they had Botox done previously and they just feel heaviness, and how they can reverse that. It's just time. The best is time. And the most important is because we have to wait until the Botox goes away. But at the same time, it's always the better undertreat. Sometimes patients come to me and then they said, I had the treatment done, I had Xeomin, I had Botox done, and I feel this heaviness. So it's more about the look because of the amount that they are getting, and that's when they wanted to reverse. So there's no real reverse for the treatment. Time is the best, and you have to let it metabolize and go away. But the best approach is to do less and then you go up and up. So in general, there is no reverse treatment for Botox or Xeomin. The only thing is to either certain eye drops that is gonna help you open your eyelid, and that is gonna help you go through, or the other is just time, which is gonna wait until the Botox metabolizes and goes away from your body. In general, especially for pregnant women, it's better that you can get your treatments done until the day that you know that you're pregnant, and you don't need to reverse or anything like that. It's more about just not doing any Botox treatment during pregnancy and after when you're breastfeeding. So you will have to wait until you completely finish breastfeeding to go back to do your Botox treatment.